Hey, Dr. Marshall with Powdersville Wellness. We talked about recently about pregnant mothers and the need for adjustments. Should she get adjusted? Should she not? And the answer is always yes, get care. But we're not doing the same things that we do for a regular adult, obviously, because you have something growing here, a baby growing there. And so you don't want to put those pressures in. Now, well, what happens once the baby's born? Did you know up to 100 pounds of force can be put on the baby's neck and head when it's pulled out from a C-section? Same thing when the baby is pulled out vaginally. You can put a lot of force on that delicate tissue in the neck. And so there can be little micro tears in there, and that can affect them going forward. So you want to understand, if there's some stress in there on the neck, can we alleviate some of that stress? Now, don't come in there and do all these crazy adjustments you see and people talk about, they worry about ripping your neck off or putting a lot of torque in there on the neck. No, you don't do that at all. You're just putting a little bit of pressure with your fingers on most of the time it's the upper part of their neck. It's called the atlas bone. That's the main bone that your spinal cord runs through to begin with. So when that bone is misaligned, then it puts pressure not only on the spinal cord, which they need for thriving to hit those milestones for all that information to go from your brain down to your body to tell it how to grow and change. And so that bone can also shift left or right, which in that position you've got what's called the eustachian tubes in our ears. As a baby, those are straight across, so they're not going to drain as well. So you want to get that pressure off by just a little bit of tiny pressure on that atlas bone. So we're not doing any twisting and turning of that neck. We're just putting a little bit of pressure on there. And then what happens is that takes the stress off of the eustachian tube. So then the ears can drain, and that reduces their likelihood of ear infections. You're also going to want to check them, see how their legs and hips are moving. You're going to take some pressure off of their sacrum by gentle adjustments there. And I'm just talking about like just a tiny bit of pressure there. It's all that's necessary. Take some pressure off there, then they can poop better. If they don't, you want to recognize as a parent, as a mom, if you're breastfeeding, does my baby only go to one side? Do they not want to turn their head to the other side? That means there's pressure on their spine, their atlas is out typically. And so just a little gentle adjustment there will allow them to turn their head. There are the issues that babies have, torticollis, maybe they're having digestion issues, maybe they're not pooping and peeing properly. That's all stress on their nervous system, stress on their spine. And just gentle adjustments, we can take that pressure off of them, help them to thrive, help them to sleep, which then helps mom and dad as well. So you can adjust the baby out of the womb all the way up till they're walking, obviously, and then, as they're toddler and an adolescent, and you're just trying to take the pressure off of their spine, off their nervous system to allow them to function at their optimal level. So bring them in, help us get them checked.